want to just put that to
Yeah.
light to say, like, no, literally, like, we think it's normal, and then worse, because there isn't the data in women's health, and
Hmm.
our moms and grandmas and aunts and sisters also
Right.
think it's normal. We're kind of like in this massive pain is normal, bad is normal,
Yeah.
sneezing and peeing is normal, and it's funny. So yeah, let's.
Oh, I got chills as you shared that story because I think it's such an amazing, analogy. Things that present as chronic UTIs, but it's actually pelvic floor dysfunction. And so there are some really interesting things you can do where you're maybe not solving, the root cause, let's say in the menstrual cramp issue, but you can find comfort measures through pelvic floor therapy interventions. Hearing about these issues, but there's a lot of fear around like what could happen postpartum is really starting to also prepare for what could happen. So that way, if you're at home 3 days, 3 weeks, 3 months later, and you're like, oh, I'm leaking or I'm having this heaviness feeling, you only get that 6 week visit, the 15 minutes with your provider. Incontinence can often start with young athletes. So with gymnasts, with runners who have really high impact training, but are not necessarily getting full body training around pelvic floor, you can start to see incontinence develop at that age.